This is Eyewitness News Up Close with Bill Ritter.
What we're looking at now is the apex, top of the curve, roughly at the end of April.
New York Governor Cuomo warning that the peak of the coronavirus pandemic could still be weeks away. The death toll in our area already in the thousands, and it's rising with no sign of it stopping. Nearly 90% of Americans now under some kind of stay-at-home order. Why isn't that number 100%? Meanwhile, healthcare workers complaining about a lack of supplies and life-saving equipment that they desperately need. This morning, we talked to ABC's Dr. Jen Ashton about where we stand in this pandemic, and we get some common sense advice on how to protect ourselves and the ones we love. This virus now controlling our lives. And good morning, everyone. Welcome again to Up Close. I'm Bill Ritter. You know, for years, young journalists would ask me, so Bill, what's the biggest story you ever covered? And usually there was always, the discussions, interesting discussions about elections and tragedies and scandals. And then came the 9/11 terror attacks. And that, for sure, was the biggest story. But now a different kind of enemy. A virus, invisible to all except the body parts that it attacks. And certainly the ones who are most vulnerable. A war like we have never fought or battled before. We are doing some things right, and then others, perhaps not so much, looking back. We need facts and information and calm, and we need action, and helping provide it to us every day of this week. My good friend and our colleague, ABC News Chief Medical Correspondent Jen Ashton, she joins us now. She remains at home. Jen, I understand you're not quarantined anymore, but you are smartly staying at home. You've gotten used to it, I assume, and we've gotten used to the paintings on the wall.
Yep, we're all doing the same thing, Bill. Staying home, trying to stay safe for our sake and for others.
Let me say that, full disclosure, we are taping this on Friday night. We are airing this on Sunday morning, so heaven knows this is going to change these numbers, and I don't want to get too bogged down with the numbers, but more than 7,000 people in the U.S., more than half of them, almost half of them in New York State, most of them in New York City, and it is going to rise. We haven't reached the apex yet.
We haven't, Bill, and I'll tell you that, as you know, most of my medical work has been, certainly for the last couple of months, covering this story. My practice is just telemedicine only now, but my closest friends and relatives are on the front lines, and they are working at New York Presbyterian, at Montefiore, at Memorial Sloan Kettering, and they are getting hit hard, and what they're seeing is the closest thing to battlefield medicine, only instead of shrapnel and ballistic trauma, this is a pathogen and a virus.
These microbes, I guess that's what the medical term is that we're seeing. Let's go into the healthcare system crisis first, and then we'll get into what we're seeing with public behavior, because I know you have a great insight into that. But let's talk about this, because a lot of your colleagues are getting sick. Some have died. We're going to do a story a little later about Dr. James Goodrich, I should say. Your late ex-husband worked with him. His partner worked with him. This guy was a giant. You are losing people in this battle to save civilians.
That's right. And, we saw data out of Italy which showed that about 20% of cases occurred in healthcare workers. We're kind of tracking that curve here in the U.S. We don't totally understand why. We think it may have to do with not just time, but proximity of exposure and something that we call a viral inoculum, or the viral load. That's literally how many viral particles a person gets exposed to that can make them sick. But first responders, doctors, nurses, respiratory technicians, you name it, nurse anesthetists, physician's assistants are getting sick, and they're getting very sick very quickly, and that is a major concern.
And if we start losing the people who are treating the people who are sick, because the people who are treating them get sick, then we're in real problems. I know it's been all hands on deck for people who are in the medical profession in the slightest to come in and help. But, it's not a never-ending supply of troops.
No, definitely not. And, you know, when we talk about the U.S. surge capacity to respond to a health crisis, it's about 4 S's. It's about staff, space, supplies, and systems. And we've heard so much focus on ventilators because they are that life-saving piece of equipment that so many critically ill patients with COVID-19 absolutely need. But the most valuable resource, the thing that can never be replaced, are the lives of healthcare workers. So that staff is absolutely essential in this battle. And when you see alerts on your cell phones like the one I just got today from New York City asking anyone with a professional health license to volunteer their assistance in this, that's completely uncharted territory.
And before we get into the other issues, you know, it's interesting to see the health professionals. They are first responders. There's no question. You are driven, just like a cop or a firefighter or an EMT worker. Anyone else is driven to go into the line of fire and the field of battle because you're trying to save lives. That's innate within you, I think.
Oh, 100%. And I have to share something with you, Bill. You know, before I went to medical school, I got certified as an EMT. And you fail your EMT test if you fail to do 2 things. And literally you have to say, is the scene safe? Are my gloves on? And right now, not just for first responders, but anyone dealing with this battle from a healthcare standpoint, the scene is not safe. And in many cases, they don't have gloves to put on. So this is a really, it's a bad situation.
We were not well prepared for a pandemic that was going to be worldwide. I'm not sure anyone could be as prepared as we should be. But how much have we learned? And, you know, we could, the most funny thing I heard this week was we could pull out of this and it could come back and slap us right in the eye again.
Well, Bill, to be clear, you know, for over a decade, there were people in the fields of science, medicine, and public health that were predicting a pandemic, a global pandemic. You know, you may remember that early on in this, you and I talked about a drill, in fact, done by Johns Hopkins University Bloomberg School of Public Health that was done in October of last year. They simulated a global pandemic. They chose, just by complete coincidence, a novel coronavirus. And they found that no country in the world was fully prepared for an epidemic or pandemic. Ironically, they found that the United States was the best prepared of everyone. But boy, I think as this plays out, and certainly in this area, we're tracking curves seen in Lombardy and Italy. I question the findings of that for sure, as I think many other people are doing the same thing.
Right, and our mortality rate is lower than most of the other parts of the country, but parts of the globe, but it's still pretty high compared to what it should be, obviously.
Well, here's the thing about mortality rate, Bill. We will not know a true mortality rate until we have a firm grasp on the denominator, which is how many people have truly been infected with this novel coronavirus. We won't get that information until we start testing millions and millions and millions of people with that antibody testing, which was just approved this week by the FDA. Hopefully in the next several weeks, not months, that those tests will penetrate, you know, the country, and we will be able to start testing people to see if they've developed antibodies. Then and only then will we be able to address a true mortality rate.
I'm hoping to come out of my own and mild suspected case of coronavirus, and my doctor says I should try, and I'm trying to reach out to them to go to one hospital specifically and get tested for antibodies, and if I am okay with that, to give plasma to patients. What is your recommendation for people who come out on the other end okay?
Yeah, I think that speaks to the incredible human spirit that we have, that we are acting now not just to protect ourselves with staying home and possibly now with wearing cloth face masks, but also, if recovered, to try to donate convalescent plasma, which is investigational, but again, it can make a huge difference, not just in science, but potentially clinically as well.
Let's talk about the vaccine, the development. I know that's a ways away, but there is some hope, and there's more talk about this anti-malaria medicine that may or may not be paying off. It's certainly not on a mass scale by any means yet.
Well, there is good news. The vaccine trials, and there are many of them around the globe, are progressing at a really good pace. The NIH-approved vaccine is in the middle of phase 1 clinical trials right now, which is encouraging. I think when you talk about the treatments, and right now they're treatments, they're not prevention, the drug hydroxychloroquine has gotten the most attention. People have to understand, and there was just a recent study published this week about another small trial in China comparing 2 groups of patients with mild COVID-19 disease. One group got standard of care, one group got standard of care with hydroxychloroquine, again, small, 62 patients. And the group that got the drug actually improved, and 4 patients in the group that only had standard of care progressed to a worsened condition of pneumonia. So it's promising. It is not ready for prime time. And Bill, you have to remember risks. There are some serious side effects associated with that medication. That's why it is only recommended now for hospitalized patients.
Very good point. So we shouldn't put all our eggs in that basket of hope. We have just about a minute left, so the pop quiz time. The mask. This is a good professional one. This is the scarf. They are still the same thing you've always been saying from what I can read. Tell me if I'm wrong. It's only to protect those who don't want to get the virus from those who do have it. If you have the virus, wear one of these. Otherwise, it's not going to really help you from getting it.
Basically correct, Bill, but when the CDC revised their guidelines and made it an official but optional recommendation for the general public to cover their faces with any type of fabric, they are doing so to protect others. It is not for the person covering their face. That still holds true. Okay. So again, when you figure out risk benefit, it's probably low risk, and there may be some benefit to protecting others.
Very quickly, I sent you a study by a group called I Square, looked at how we were looking at this as Americans versus Germans, and we are taking this very hard in terms of mental fitness and mental health.
That was so interesting, Bill, and it really has to do with the psychological processing of a health crisis like this, how we react when we hear words like threat, illness, sickness, death, crisis, a little different than people in Germany do, and that may then affect how we respond to it. So we are more concerned slightly than people in Germany, but only time will tell how this plays out.
Dr. Jen Ashton, thank you for helping us work through those anxieties and fears and try to keep calm with the facts. We all love you very much, Jen. Good luck.
Thanks, Bill. You too. Get better.
Okay, thank you. I'm trying. When we come back, former NYP Commissioner Jimmy O'Neill joins us to talk about his new mission as senior advisor to Mayor de Blasio of New York City for COVID-19. Plus, we're going to take a look at what Jen talked about earlier, and great doctors like this giving their lives to treat others.